Evening, Dr. Henry Anyimadu, an infectious diseases specialist at the Hospital of Central Connecticut, tackled some of your questions about COVID, and he's kind enough to answer some more of our questions for us right now. So thank you for joining us once again, Doctor.
Thank you for having me.
So our first one for round two comes from Eileen in Enfield, and this is a question I think I have too. When we hear someone say 40 million people have been tested, is that actually 40 million people, or have 40 million tests been done, meaning many may be retested, and including the same people over and over again?
That's right. So according to the CDC data, currently the US has done about 40 million tests. This does not mean 40 million people have been tested, but 40 million tests have been done. So it could be, some definitely would be retested, and it's not necessarily 40 million people that have been tested. But keep in mind that it's not all the tests that gets reported to the CDC. So there could be more testing that we may be missing.
All right, so this is kind of an estimate then that we're working with these numbers. Good to know.
That's right.
Good to know. All right, well, Donna from Suffield is 65 and she has multiple high-risk conditions. She says that she's stayed at home to stay safe. She's only going to the grocery store during special senior hours, and she's not spending time with her kids or her grandkids. And she asks, how do I know when it is safe to start spending some time with my family, some that are frontline workers?
So this is always a challenging question, and there's no clear right answer to that. You have to make an individual risk assessment. The risk of you giving the virus to your family or they giving it to you. You have to consider whether they are coming from out of state or in state. Are those family members immunocompromised patients? How have they also reduced their risk of getting the virus? Have they been hunkering down? Are your grandchildren in daycare or going to camps, which will increase their risk? You mentioned that some of them are frontline workers. Have they been tested recently and they are negative? You probably want to meet them in a smaller group gatherings rather than a large family gathering. And masking, hand washing, some physical distancing will definitely be necessary. And as we know, outdoor or backyard is always better than indoor. At the end of the day, the goal is to reduce the risk as much as possible. But we all know, we all agree that you can never reduce the risk to zero. So we try, but it may not be zero.
Okay, so we need to take advantage of this nice weather if we do want to visit with our loved ones, right? Masked and from a safe distance. And our next question, we are seeing a number of people who are healthy trying to figure out what items they should have in their homes on the chance that they do end up contracting COVID. So what do you suggest, doctor?
It's important to first identify a room in your house where you can safely isolate yourself. Having a thermometer is helpful. You can monitor your temperatures just in case you have COVID. A pulse oximeter can also help measure your oxygen saturations or the amount of oxygen in your blood. And it can help you make an objective decision as to when to seek care. Mask to cover your mouth and nose when you're leaving your house or leaving your room. Tissue for covering your cough and sneezes, hand sanitizers, and even some fever-reducing medications like Tylenol can all be helpful, but none of these should delay you from seeking care if your symptoms are getting worse. And you should have, lastly, I think you should have a list of emergency contacts.
Okay, good information. Hopefully people are jotting this down right now. And finally, doctor, a symptom that we're just starting to hear about from people diagnosed with COVID is hair loss. Any idea why that's happening?
That's interesting because personally, I'm not aware of COVID-19 directly causing hair loss, but there's still a lot to learn from this virus. I can understand why that may be possible, though, because there are several studies that have shown some form of association between stress or severe illness and hair loss. COVID-19 is a major stressor on our bodies, so that could definitely lead to hair loss in a way. But as in direct causality hasn't been proven. On the other hand, though, there is some evolving data from Brown University that suggests that men who are bald may be at risk of severe COVID-19 infection. But there's still a lot more to learn from that study.
Okay, thank you so much, Dr. Henry Anyimadu from the Hospital of Central Connecticut, for all of this wonderful information. We appreciate everything that you're doing.
It's always a pleasure.